So hello friends, in this particular video we are going to discuss about benzodiazepines. So mechanism of action, and that is it is acting as positive modulator for GABA A receptors, okay, and it binds between alpha gamma subunit, and binding of benzodiazepines to here, it leading to increased chloride influx, and that will cause generation of inhibitory potential. Now this benzodiazepines drug increases frequency of channel opening, okay. This drug have no effect on duration of opening of the GABA A receptors, okay. So in presence of benzodiazepines, GABA cause increased frequency of channel opening, okay. In presence of this benzodiazepines is just acting as GABA facilitatory effect. It is causing GABA facilitatory effect. In presence of benzodiazepines, GABA causes increased frequency of channel opening, okay. Now, so this is the basic mechanism. Now what are the indications? So the first indication is epilepsy, okay. By stimulating GABA A receptors, it causes decreased neuronal activity, okay, and it has fast onset of action, so it is used for any kind of acute seizure, and it is drug of choice for the acute seizure. First point. Second, it has more efficiency, so it can be used for the treatment of respective cases of epilepsy. Third, it has also increased abusive potential, okay, so it is avoided for maintenance treatment of mild to moderate cases, so it is not utilized for the maintenance treatment because it has increased abusive potential. Now it is also drug of choice for status epilepticus, and is status epilepticus we use lorazepam and diazepam, okay. Lorazepam is more preferred. So the first is epilepsy, drug of choice for acute seizure. It can be used for treatment of the refractive cases of epilepsy, high abusive potential, and the drug of choice for the status epilepticus. So these are the important MCQ questions. Now moving to the next. So it is also used for the childhood epilepsy treatment, okay, refractive cases of childhood epilepsy. In this we use two drugs, that is clonazepam and clobazam, okay, and this clonazepam is used for infantile spasm or absence seizure. In two cases this clonazepam is used, and it is used through intranasal route in cases of acute repetitive seizure, okay. This clobazepam is also used for atonic seizure in LGS cases, clear. Now it is also the drug of choice for acute seizure caused by drug. Lignocaine toxicity usually causes acute seizure, so in that case you can give this benzodiazepines, okay, and here we provide lorazepam through IV route. So we have discussed about epilepsy, in which we have discussed about the drug of choice for acute seizure, drug of choice for acute seizure caused by any drug, and then again drug of choice for your status epilepticus, okay, and also it is used in treatment of the refractive cases of epilepsy, and the drugs are lorazepam, diazepam, clonazepam, and clobazam, clear. Now moving to the next indication, that is your insomnia. So by stimulating GABA A receptor, it causes the depression of RAS and locus coeruleus, that will cause sedation and hypnosis, okay. It also causes decreased latency to fall asleep, so it is used for the treatment of early insomnia. It also decreases late night awakening because of the long TF, so it is used for the treatment of late insomnia. So it can be used for the treatment of both your early insomnia as well as your late insomnia. Late insomnia because of the long TF, okay, so it causes decreased chances of late night awakening, clear. Now due to this long TF, there may be hangover situation, okay. In this situation, judgment of person get decreased, clear. Now chronic use can lead to disturbed sleep cycle, so we should avoid the chronic use of this drug, clear. So chronic use generally disturb your sleep cycle. Now next point, that this benzodiazepines stimulates your second stage of NREM, okay. So patient remain in stage 2 of NREM increases, means duration of this second stage of NREM get increased, okay. So if this NREM stage gets increased, then REM time will be decreased. So I have written that benzodiazepines causes quantity of sleep increase. It increases the quantity of sleep, but quality of sleep it decreases, okay, because quantity of sleep increases because of the NREM increase, but quality of sleep decreases, okay, because of the lessening of the REM. And drugs which are used here is triazolam, temazepam, and itrazolam, okay. Triazolam, temazepam, and itrazolam drugs are used here, clear. Now for treatment of insomnia, give benzodiazepines for 10 days maximally, not more than 10 days. So we have discussed the second indication, that is insomnia. We can use it for early insomnia, late insomnia, as well as your one more point, that we cannot use for longer period because it can cause your disturbed sleep wake cycle, okay. And the drug are triazolam is the best drug. Triazolam is the best drug here, okay. Now the third indication is your anxiety. Benzodiazepines causes decreased anxiety, so by decreasing the activity of locus coeruleus, it decreases noradrenaline discharge. So if noradrenaline discharge decreases, then your anxiety symptoms will also get decreased. So restlessness, insomnia, tremor and seizures all will get decreased. Clear? Now the drugs used here is eprazolam. Also sometimes chlordiazepoxide is also used. It is used in chronic anxiety. Okay, so remember this eprazolam. So decreasing locus ceruleus function, decreasing noradrenaline discharge, decreasing anxiety symptom. The second is your by suppressing RAS. Okay, RAS will be suppressed. So if RAS will be suppressed, then your sedation will increase. Okay, so patient will remain in sedation conditions. Now third, it is a drug of choice for acute attack of anxiety. In acute attack of anxiety, they are the drug of choice. Clear? Maybe panic attack, acute phobia, post-traumatic stress disorder. These are the acute attack of anxiety. Okay, panic attack, acute phobia, post-traumatic stress disorder. In all these cases, they are the drug of choice. And for panic attack, especially diazepam is used. Clear? And avoid chronic use because it can cause addiction. So we have discussed the third, that is anxiety by locus ceruleus, RAS. Okay, and one drug you have to remember eprazolam for this locus ceruleus, and acute attack of anxiety you have to remember diazepam, and like this all. Okay, now moving to the fourth indication, that is your alcohol withdrawal syndrome. Okay, it increases your withdrawal center. Okay, it benzodiazepine inhibit your withdrawal center, so it can be helpful in alcohol withdrawal syndrome. Now chlordiazepoxide is the drug of choice for this. Okay, chlordiazepoxide is a drug of choice for this. Chlordiazepoxide is metabolized in liver, so if liver function get decreased, then you have to use lorazepam and oxazepam. Okay, you cannot use chlordiazepoxide because chlordiazepoxide is purely metabolized in liver. So if there is liver failure or liver function get decreased, then you should use lorazepam and oxazepam. Okay friend. Now if delirium, then you should use diazepam and lorazepam. Okay, so alcohol withdrawal syndrome, the common drug of choice is chlordiazepoxide, but you cannot use chlordiazepoxide in cases of liver failure, so you have to use lorazepam or oxazepam. Okay, so till we have discussed many drugs. Here we have discussed triazolam, that is best drug for the insomnia. Here we have discussed eprazolam, then we have also discussed here chlordiazepoxide. Okay, then we have discussed diazepam, then here discussed lorazepam, oxazepam, chlordiazepoxide. Now the fifth indication. So first indication was your seizure. Then we have discussed about insomnia, then anxiety, then alcohol withdrawal syndrome. Then the next is your pre-anesthetic medication. They can be also used as pre-anesthetic medication. How? So it decreases anxiety, increases sedation, increases hypnosis. Okay, so the dose requirement of anesthesia drug will be decreased. So in presence of this drug, the dose requirement of anesthesia drug is less, and lorazepam, diazepam, and midazolam is given, and midazolam is more preferred. Okay, so this is the fifth indication, that is pre-anesthetic medication. Now the sixth is your symptomatic relief. So in acute mania cases, acute episode, chorias, akathisia, you can give these drugs. Now it also acts as muscle relaxant. How? Diazepam stimulate your GABA A receptor, also stimulate GABA B receptor, and causes muscle relaxation. Okay, so in cases of cerebral spasticity, multiple sclerosis, you can give these drugs. So these are the common indications of this drug. Once again I will revise you. The first was epilepsy, important, that is drug of choice for acute seizure, drug of choice for status epilepticus, abusive potential. So you have to, you cannot use for maintenance dose. Then this was the drug of choice for acute seizure, which is caused by any drug. We have also discussed it. Then insomnia cases. Okay. Then we have discussed about NREM stage 2. This was the important point. And triazolam was a drug that is important in anxiety, locus ceruleus, RAS, acute attack of anxiety. Then alcohol withdrawal syndrome we have discussed. In alcohol withdrawal syndrome we have seen about the chlordiazepoxide. Then pre-anesthetic medication, in that we have seen here midazolam, then symptomatic relief and muscle relaxation. Now coming to the pharmacokinetics of benzodiazepine. So oral, IV route, intramuscular, rectal, nasal spray, all the routes. So IV route is lorazepam and diazepam, and intramuscular route is midazolam. We have discussed midazolam here. This pre-anesthetic medication. Okay, midazolam. So this midazolam is usually given through your intramuscular route. Okay, so MM. Then through rectal route we can give diazepam for treatment of the febrile seizures. Okay, this is the drug of choice for the treatment of febrile seizure, diazepam through rectal route. Through nasal route we can give midazolam. Okay, so fast onset, compliance will be good. The next is your lipid solubility. Diazepam is highly lipid soluble, so given with IV route. Okay, onset of action is 30 seconds, increase more entry in your perfused organs. Okay, and duration of action is 30 minutes. Now discussing some important points about lorazepam. So it has decreased lipid soluble. Onset is 50 seconds and it not undergoing redistribution. So the action is for 2 to 3 hours. The difference between lorazepam and diazepam. This diazepam is highly lipid soluble, so it has more redistribution properties. So action is only for 30 minutes, but your lorazepam has less lipid solubility, so no redistribution phenomenon here. Okay. Now moving to the next. The third is your decreased protein binding. So we compare lorazepam with diazepam. So lorazepam having very less protein binding capacity, so more free concentration is available to cross blood-brain barrier. Okay. So there will more free concentration of product because of the less protein binding. But in diazepam more protein binding, so less free concentration is available. Clear? So lorazepam has less protein binding, but it is somewhat lipid insoluble. Lipid insoluble in compared to this diazepam. It is also lipid soluble. This lorazepam is also lipid soluble, but in compared to diazepam, it is less lipid soluble, but has a less protein binding also. So less lipid soluble, less protein binding. Remember like this. Now the fourth is no liver enzyme interaction, so there is no drug interaction. Wide therapeutic index, so safe to use, and flat slope of DRC, so incidence of toxicity is also less. So no drug interaction. There is wide therapeutic index, flat slope of DRC, so incidence of toxicity also less. Now all drugs are metabolized by phase 1 enzymes. Okay, except your lorazepam and oxazepam. These are metabolized by phase 2 enzyme. Lorazepam and oxazepam. In liver disease, phase 1 enzymes get inhibited, okay, or there will be absence of the phase 1 enzyme, but phase 2 will be normal. So in liver disease, you will use lorazepam and oxazepam. Mind this. In liver diseases, you cannot use other drugs except this lorazepam and oxazepam. So question is asked like which of the following drug will be administered in liver failure or liver disease any. So lorazepam and oxazepam. Now the next is all benzodiazepines have long T-half, okay, except your triazolam. Triazolam is the shortest acting. We have discussed about triazolam. Okay, where we have discussed? So here we have discussed triazolam here. Sleep. The first drug, the best drug, was triazolam. Then midazolam, etizolam, and temozepam. These are the 4 drugs which have short T-half. All benzodiazepines given in active form except clorazepate. Okay, clorazepate activated in stomach mucosa. Okay, so all benzodiazepines is given in active form except clorazepate. Clorazepate is activated in your stomach mucosa. Now coming to the side effects of the benzodiazepines, so it suppresses RAS as we have discussed, so increases sedation, drowsiness. It also can depress your respiratory center, so decreases respiratory rate, so contraindicated in any patient who have respiratory disorders. Depresses your VMC, vasomotor center, so decreases BP, decreases heart rate. Long T-half, so hangover situation, loss of judgment will be there. Decreases anxiety, so may have abuse potential as we have discussed. Tolerance also develop. Okay. Decrease granular secretion, so decrease acid secretion in GIT. Pregnant, it can cause in pregnant female, it can cause intrauterine growth retardation, and it can, if chronic use in insomnia cases, then it can modify your sleep cycle. The one drug that is flunitrazepam. Okay, this is flunitrazepam. This is also known as rape drug. This is tasteless, odorless, and increases sudden sleep and amnesia. Okay, and this is mixed with any drink which you will take. Okay, so it is another date rape drug. The name is flunitrazepam. The next side effect is amnesia. So anterograde type of amnesia. So these are the sedation, then respiratory center suppression, VMC, long T-half, so hangover, decreased anxiety, so abuse potential, tolerance, decreased granular secretion, pregnant female, then chronic use in insomnia. It also not given for children for long term. Then flunitrazepam. Amnesia. Now toxicity is rare, and if respiratory and vasomotor center get more depressed, then it can cause death. So how we'll treat in toxicity cases? So basic life support, as we have discussed in our previous videos also. Then you will do gastric lavage, okay, with the help of activated charcoal. Now the next is you will give antidote that is known as flumazenil. Flumazenil is the antidote for this. Okay, this is competitive inhibitor of benzodiazepines. Binding site of this is alpha gamma interface. This is non-specific inhibitor of GABA. Reverse all toxicity symptoms except your respiratory rate. So put on ventilator. So when patients should be put on ventilator because it can reverse all the toxicity symptoms except your respiratory rate. Through IV route, onset of action is 4 to 5 minutes. Okay, lipid solubility, so increase in CNS, peak will be at 30 minutes and action is for 60 minutes. Supportive treatment you should also give. Hemodialysis can't be done. Okay, so these are the benzodiazepine. Two more point. Your one next is your ganaxolone. Mechanism of action, it is a GABA A receptor agonist. Use is for infantile spasm, prophylaxis of migraine, like this. Then one more drug, STB-Pento. Okay, it is approved just recently in 2018. This drug STB-Pentol is approved in 2018. Mechanism of action is GABA stimulant, GABA receptor agonist. Clear? So these are the drugs of the benzodiazepines. So thank you.